We're live from Tijuana, Mexico. It's Thursday. Okay, I'd love to say Saturday Night Live. Okay, now I've got two cameras. I want to show you what we do down here because this is called Real People, Real Problems, Real Challenges. So number one, okay, check this out. Okay, now I'm going to show it on two different cameras. But this one here, look at the teeth, okay? What you're looking at on the teeth up in this area, you're looking at root canals, dental implants, and extractions. Okay, so I want you to see that. Root canals, dental implants, extractions. Okay, now, hugely important, okay, when you're looking at this, there could be cavitations in there. There could be no problems whatsoever. So you don't know until you do a thermography. Now, this is a thermography. When you're looking at this, we've got the right chest, left chest here. When you see massive inflammation like that, okay, massive inflammation like that in that area, that's where lymph drains for the face, mouth, lung area. So this is huge. So when you see that, and think of this, there's only three stressors. There's physical, chemical, and emotional stressors. You have to address each one. If you are not addressing the physical, chemical, emotional stressor, you will not get better. You will not get better. And this is one of the most missed causes and contributing factors to fibromyalgia. We're talking Parkinson's, Lou Gehrig's disease. And then if you're concerned about electromagnetic frequencies, or electromagnetic fields. They are all around you. Those metal implants, the titanium implants, act like a magnet, like an antenna, negatively affecting your cell production. This is the whole thing. If you build cells faster than they break down, that's called health. If you break down faster than they build up, that's a disease, baby. Okay, and you've got to address that. Now, we actually do those tests. We've got a holistic dentist down here. Now, if you can't make it to a Huggins protocol dentist, don't get the work done. Okay, find one. And you've got to figure, like if an extraction's done, here's just for an example. If they've got to pull a root canal, first they've got to do a blood analysis and a thermography and a digital panoramic x-ray to see if it's even negatively affecting you. Because if you do an extraction, and this is the Huggins protocol that we do right here, you got to pull the tooth, but then you've got to go back in, totally different operation, to remove the ligament. Now, the ligament is right next to the facial nerve, so this is one of the reasons they don't do a lot of this stuff up in the States. But then once you remove that ligament, then you've got to take the patient's blood, spin it down to plasma cells, inject the opening so the bone regenerates, then you treat that with ozone, and the whole process is done while you have a vitamin C IV. So this way you get the antioxidants. Now, by law down here, we got to give a pain reliever and antibiotic, but I'm telling you, 90% of the people don't need it because you're getting that antioxidant during that inflammatory process. Now, that's one test. Now, obviously, when I'm showing you this guy's x-rays, you're looking at his neck, which is like, damn, there's loss of curve degeneration. Yeah, and so that's what we do. We do stress x-rays, adjustments. We do post x-rays to document the structural and neurologic changes. Hugely important. So I'm going to show you a bad blood analysis and a worse blood analysis. Now, this is a live blood cell analysis, and there is a lot of stuff going on here, but at least the cells are separate. Those are the red blood cells. I mean, if anyone that's looked at the live blood cell analysis is going to go, hey, baby, that ain't normal. No, it's not. But at least the red blood cells are separate. You can see stressors, like you can see inflammatory markers, excessive platelets. You can see parasitic activity where the cells aren't exactly round. All that stuff you can see. But you better, if you're driving, pull off to the side of the road right now, because this is a shocker. Do you want to see what blood clots look like on a microscope? Okay, this is what we do. We do a live blood cell analysis to check. Now, this is a response to a foreign pathogen, and those cells that are supposed to be separate, when they start clumping together, all that means is a stress. Luckily, there's only three. There's physical, chemical, and emotional. So if you get one of the most common stressors, okay, something that we can't say with the censorship, okay, if you get one of those, This is what a blood clot looks like on a microscope. It's called an aggregation. It's also called rouleau coin formation. And you got to figure, you get those red blood cells that are supposed to be separate and beautiful, holding oxygen and transferring that oxygen carbon dioxide. You stack those suckers together, there is less surface area. You're talking the blood becomes acidic. You can't alkalinize. Your immune system doesn't work right. It's the health of the blood is everything. Now, when you find a practitioner that does a live blood cell analysis, okay, find a guy that does another live blood cell analysis to show that you corrected the problem. Oh my God, what a concept. Okay, actual objective analysis to see that your body is holding oxygen. Okay, and that's what we do. If you have something like this, you've got to get antioxidants. I mean, we do blood ozone, okay? We also do EDT chelation. You can't chelate from some of these jabs, okay? Because it's literally causing your body to produce a poison. So, but you can chelate from other heavy metal exposures. Just find the solution. There's too many doctors out there that are prescribing a drug, a pain reliever, antidepressant, anti-inflammatory, when inflammation is how the body heals. That's insane protocols. Those are antiquated protocols that should not be practiced. The doctor has to respect that the body is responding correctly given the environmental stimulus. And by God, this is a toxic, dangerous environment. We've got to stop that world, change it. Does that make sense? Yes or yes? I'm only giving you one choice. So if you cannot make it down here, find somebody that does an objective analysis. They take an x-ray and they're going to do a post x-ray. They do a blood scan, they do a post blood scan. They find the problem. And anybody that says it's hereditary, genetic, runs in your family, fire that doctor, because you can name multiple relatives that you have that have the same gene makeup that don't have the same problem. So there's a difference between genetic and genetic expression. Look, be confident that your body is built in the image and likeness of God. You're smart. Okay, you got 3 stressors that you got to fix: physical, chemical, and emotional. Physical is assessed by a digital x-ray, posture analysis, muscle test. Chemical, if you have poor sleep patterns, if your blood looks like crap, okay, if you have skin issues, those are all chemical stressors. Emotional stress, your body responds the same way to physical, chemical, and emotional stress. We use neurolinguistic programming to reprogram that subconscious. There's emotional freedom technique. And think of this. If you master your emotions, okay, you change the chemicals your brain secretes. Think of those masters that meditate and can raise or lower their blood pressure. You have to address all 3. If you're only addressing 1 or 2 of those, you are not going to get better. This is why, like most clinics, you go there, they're going to give you vitamins, an IV, steroids, okay? Yeah. Is that addressing the cause? No. If you go to the standard corrective chiropractor, beautiful, you're going to get the correction. But if they're not addressing the sleep issue, if they're not addressing the bowel issue, you're not going to get better. Find the source and keep looking till you find a doctor that does that. This is Dr. John Bergman, real people, real challenges, real solutions. Find the solution. God bless you. I'm with you.